Feed your head, engage your brain, and enter the mind's eye. Your one-stop shop for politics to paranormal and everything in between. I'm your humble host, DJ BJ Turnov, and you're listening to The Mind's Eye on Z Talk Radio, the best internet talk radio, period. It's time to reanimate ourselves from the dead of winter. Another gorgeous evening in LA on this February 15th day. And I hope you see the same thing looking through your window because I know you definitely see something beautiful every time you look in the mirror. I don't know, maybe I'm just buttering you up because it's the day after Valentine's and I may have forgot to send you flowers. So consider this episode my little love letter to you, Schnookums. Or maybe I'm just plain giddy because The Mind's Eyes just celebrated our 4th anniversary. We're almost 100 episodes in, and for those who've been listening from the start, God bless your little heart, because you're a real trooper, sticking with us through all the different incarnations that we've gone through. And I hope you're excited for what the next 4 years brings. And we're going to start that tonight with a double dose, 2 hours for the 200th anniversary of Mary Shelley's classic Frankenstein, or Modern Prometheus, one of the most influential books on the science fiction genre. We're going to take an alternative look at the classic novel. Was Shelley really inspired by a dark and stormy night telling ghost stories? Or is there more to a tale of a man who created a monster? Is there some science fact amongst the fiction? Chemist and author Catherine Harkup steps into the Mind's Eye laboratory to experiment with answering these hair-raising questions, which is also addressed in her brand new book, Making the Monster: The Science Behind Mary Shelley's Frankenstein. Dr. Harkup and I, we're going to examine the 18th and 19th century science and scientists that influenced Shelley's most famous creation. You'll hear a few stories about the sensational science demonstrations of the time, which caught the imagination of the public, including experiments with electricity on human cadavers in the public forum. I know it sounds a bit abhorrent, but many of our modern achievements are actually a direct result of these scientists who conducted their pretty gruesome experiments on the dead. And even if we are still a bit far from being able to recreate Victor Frankenstein's monster, scientists are still trying to create the building blocks of life. Is the dream of creating life from nothing tantalizingly close? I mean, how close are we today to legitimately bringing people back from the dead? Ira Pastor, CEO of Bioquark, which is a life science company, will join us in the second hour to tell us how close we are to fulfilling these once absurd dreams. Biocourt's mission is to give people a second chance at life by conducting cutting-edge science experiments in regeneration and reanimation of the brain and body. You'll find out exactly how they're doing it in the second hour, right after our next guest and the first guest, Dr. Catherine Harkup, on Making the Monster: The Science Behind Frankenstein on the 200th anniversary, coming up in a Mind's Eye moment on Z Talk Radio. We're back. You're listening to The Mind's Eye on Z Talk Radio. I may have blown a little bit of a nerdgasm this past Sunday, geeking out at the 51st Annual Antiquarian Book Festival in Pasadena. You heard right, that's an actual thing. And I don't know if it's synchronicity or coincidence, but this year's theme just happened to be celebrating the 200th anniversary of Frankenstein, just like we're doing tonight. Being based in LA, we're pretty lucky here to have access to some of the best institutions in the world. One of them being Occidental College, which just so happens to have a first edition in their collection, and really not too many of those left, particularly in that type of condition. Luckily, I snapped a picture for you. Remember, this is my love letter to you. Take a look at our new Instagram page. It's there now. Same deal as all of our other social media. The name is @MindsEyeShow. And as you know, Instagram is really just a pictorial representation of the show, and it doesn't really give any new news or access to our show archives or any information about our guest. If you want that information, just go to our Twitter handle @MindsEyeShow. Same deal on Facebook. But while you're on Twitter, don't forget to cast your vote in this week's poll. Would you want to be reanimated from the dead? And there's only two answers, yes or no. People, please, no weird comments like, only if I could be reanimated with my dead pet mouse. I mean, and I wouldn't be surprised if we got something like that, knowing our listeners. Gotta love you guys. And there's no better time to cast that vote now because we're about to hit a commercial break. We'll be right back with Ira Pastor, CEO of life science company Bioquark, who is a real-life Victor Frankenstein working with life science company Biocourt, giving people a second chance at life. He's going to share some of that knowledge on their cutting-edge science in regeneration and reanimation. And if you don't join us in the final hour, I am going to have our first hour guest, Dr. Catherine Harkup, poison you. Don't move an inch, or maybe you can't because that's the toxins in your body right now. Either way, we'll see you shortly. You're listening to The Mind's Eye. Put the beakers aside for a moment. We're talking shop with Ira Pastor, CEO of Biocourt, which appears to me to be one of the most interesting and possibly cutting-edge science companies out right now. Mr. Pastor, much obliged for a Mind's Eye moment.
Thank you so much for having me.
Let's just jump right into it. Tell us a little bit about Bioquark, its history, and its mission.
Sure. So, Bioquark is a life sciences company. We focus on, what we call in-house the 3 R's: regeneration, repair, and rejuvenation, all with a focus of improving human health and wellness. And basically, the core of how we got started was on focusing on the natural world and all of the wonderful species out there that live on this planet with us that from a health and wellness perspective are just so much further advanced than we are today. And whether that be the amphibians and their ability to replace lost or damaged organs and tissues that are identical to the ones they lose, whether that's their spinal cord or limbs or eyeballs or parts of their brains, or whether it's species like planarian, worms that can get cancer and then 2 weeks later just get rid of it as if it was the common cold, or whether it's the more extreme stuff, the species that just don't age, the ones that age in reverse, or even the ones that technically even die and come back to life. Our mission is all about saying, well, why as humans can we not do these things, and how can we, using the tools that we have in front of us in terms of 21st century biology, biotechnology, and so forth, figure out how to reawaken some of these capabilities for the purposes of human health. And that has been our message and our mission since we started up.
In the research that the company has done, would you say that there's one underlying factor to explain why these supposed quote unquote lower forms of organisms do have these complicated abilities for regeneration, yet humans don't?
Yeah, absolutely. And it is all what we call a flexibility, let's say, to turn back biologic time in their cells and start over in a controlled fashion. So this is one of the main things that we see, whether we're talking about regeneration, whether we're talking about reversion of disease, sort of taking a cancer cell that is damaged and erasing its history and starting over, or whether we're just talking about age reversal. At the end of the day, it is all about the ability to wipe out what was done over a period of time, whether that's genetic damage, epigenetic damage, and other insults that occurred during the course of living and life, and starting over again. We don't have those abilities. The other factor that comes into play, a lot of the people sort of in evolutionary biology will tell you, is we as humans, we are a species that bleeds very rapidly. We die from the loss of blood very rapidly too. And so sort of evolution nudged us in the direction of a rather potent wound healing response. We're very good at clotting and forming scar tissue. But when it comes to the complex forms of regeneration that we desire, that we see elsewhere, that's going to take some more tricks. We want the wound healing response, no doubt about that. However, we want to sort of reconnect with the ability that we see. And we do see some of it in humans, only at a very brief period of time when we're first formed as an embryo. That sort of ability to reset, the ability to start over, clean up DNA, clean up epigenetic damage, and reset age. So we see the possibilities and we know sort of how the genome works and accomplishes it at that early stage. We just want to translate it from sort of one cell now to the 50 trillion or so that represent our bodies.
I mean, that sounds, fantastic. Who wouldn't want to be involved with that? I mean, is that the reason why you chose to go on with Bioquark?
Yeah, I mean, my history is 30 years or so immersed in the traditional pharmaceutical industry. And, although it was a fun and interesting place to be, generates $1 trillion a year now. At the end of the day, I was not very happy selling, cholesterol-lowering drugs and painkillers and so forth, and realized that we've created $1 trillion in your industry based on symptoms. And symptoms are fine. We got good at doing that for the last 100 years. But curing something versus treating it is a very different thing. It's not a matter of interfering with the symptoms anymore. It's a matter, as we were saying, really understanding what it takes to make cell B younger again and turn it into cell A. And so that's a very different mission than sort of the pharmaceutical industry is set up to do, and what I learned the last 30 years. And so, for my family's sake, the future, watching my parents and my grandparents perish at some at the sort of the feet of some of these destructive degenerative diseases, I wanted to do something sort of different and more exciting and more meaningful with this sort of second part of my career.
Pharmaceutical industry, it is one of the one of the factors that go into the increase in life expectancy over the last 50 years or so, which has increased by about 2 decades for each person globally. How much more can we go?
Well, if we do things right, we can go a lot further. We did a very good job, no doubt about it. And I was on that side of the table, and I talked that message of pharmacoeconomics and so forth very well. But the point is, yes, we've created a lot of interventions. Yes, we've increased quality of life. We've increased lifespan to an extent. But when it comes to cure now, when it comes to sort of breaking through the window, the last really official cure we ever created was the antibiotic. Really nothing after that has anything to do with curing. So we have a lot further to go. And whether it's things like Alzheimer's or cancer or diabetes, these are the big things that kill us and send us out of this world every year, and we just didn't have the answers for it. It's more of a structural issue. I can go more into the detail of why this is the case, but I think we have a lot. I think there's a lot that we can do, not just in terms of the chronic degenerative diseases, but even the amount of people we lose every year to just blunt force trauma and acute traumas and the destruction of the central nervous system. We have the ability to make a major impact when we perfect these forms of regenerative medicine.
And I believe traumatic injuries is something that Biocourt is researching. Do you think that's where you've probably made some of the biggest headway?
Yeah, we've had a lot of excitement and success in the lab to date on this particular front, and the central nervous system has clearly been a focus of ours. We've been working specifically on traumatic brain injury models, Parkinson's models, and spinal cord injury. Now, we also got a little bit of press last year from another kind of outside the box project having to do with living cadaver research, which is another important part of the puzzle. But yes, so of the 150,000 or so people that die every day, about a third of that is trauma, acute trauma to the central nervous system. And this is a big issue because, whether we're talking about the acute trauma or whether we're talking about the chronic degenerative disease of the central nervous system, things are coming fast and furious. And while people may argue that heart disease and cancer kill more people every year, there is a very good case to be made that this sort of tsunami they're talking about of Alzheimer's and dementia that is headed our way in the next 10 to 20 years is going to make cancer and heart disease look like nothing. Because while we do have very average drugs for cancer and heart disease nowadays, we have nothing to interfere with the problems of dementia and Alzheimer's. And just 2 weeks ago, Pfizer, the fourth largest drug company in the world, announced that they were abandoning it altogether just because it was too difficult a space and they were losing so much money in it. We need solutions, and so we're staying the course.
One of the biggest questions that we always ask in most of our topics that we discuss is, where does the money come from? I mean, who funds Biocourt?
Yeah, we're funded today primarily by high net worth private accredited investors, pretty much located here on the East Coast. We did not go on through the sort of the institutional life science private equity well yet. I've been down that path with previous companies, and it's not overly enjoyable. But this is a cash-intensive industry. They say if you're not always raising money, you're not doing your job. We'll get there, but right now it's just private accredited investors for now.
Okay. Any big famous donors?
No.
Not like you could say anyway. I was just putting you.
No billionaires yet at the table, but that's fine. We don't need those deep pockets as of yet.
Oh, no, Warren Buffett's not funding anything at the moment. Oh, okay.
I don't know if he ever has.
Let's talk about and get into some of the work that you guys are doing. I believe I read something recently that said that you guys were approved somewhat recently an application from the National Institute of Health. We're going to be doing a small pilot study working on some traumatic brain injuries. What's the word on that?
Yeah, and that is what we call the Reanimation project. That is a really exciting project. It's moving, obviously it's a little different than a traditional study because it involves living cadaver research, which is a form of research that has gone on for the last 30 years now, very quietly for the purposes of studying high-dose toxic substances on people that donate their bodies to medical research. We are focusing on a protocol using living cadaver models for regeneration of the central nervous system, particularly the brainstem in people that have so-called severe disorders of consciousness. So that is a more dramatic, let's say, project, a little different than sort of a cancer or an Alzheimer's program, but that is nonetheless a important area that we think is to focus on, just because when it comes to the severe disorders of consciousness, and we're not just talking about brain death, but everything else in that continuum, coma, persistent vegetative state, Terry Schiavo, and other conditions, there's no money at all that has ever been pumped into research in that domain. So we're beginning to take some baby steps there. We've been doing a little more in the spinal cord and making more progress there, and that's been very exciting for us because the spinal cord has sort of been it's been predicted for the last 20 years that that's something that, stem cells will take care of for everybody, but stem cells haven't had a great run just because when it comes to curing spinal cord injury, you not just have to repair and regenerate neurons in the spinal cord, but you have to do two other things that are very important. You've got to get rid of the scar tissue that's blocking their reconnection, and you have to make sure they connect appropriately, because you don't want a signal coming down from your brain to raise your left arm, raising your right leg. So there are other intricate components of spinal cord regeneration that we have worked on, which are quite exciting, and not only how we regenerate, but how we get the connections to happen appropriately, just like they do in the salamander, and just like they do in our spinal cord when we first form in our mother. So those have been two very important areas for us, and it's been kind of an exciting time. And the central nervous system is something that we will, purely, we will dedicate ourselves to constantly, because it is, in our opinion, a great sort of the last great frontier of problems that we have to deal with as humans.
How close would you say you are to any breakthroughs with the spinal cord and I guess the Reanimation project of the brain injuries?
Very close. Actually, we have a conference that we're going to be presenting some top-line phase 1 results at in Toronto. They're coming in this October, where we'll be talking about a couple cases, but very close, very close. Now we still have our work to do in terms of registrational size studies, but nonetheless, the the initial data that's coming out with some of this work is pretty eye-opening, and we're happy now that we spent a lot of time in the lab the last several years, but now finally sort of getting out there with partners doing initial sort of phase 1 proof of principle work, and then getting out there in the scientific communities at scientific conferences and presenting results. It's going to be a very exciting 2018 for us.
Have you been facing a lot of ethical issues?
Not really. I mean, anything, when it comes to the Reanimation project, I mean, living cadaver research has gone on for the last 30 years. We didn't invent it. And clearly, there are appropriate informed consent documentation that we have to go through like any other study. People do donate their bodies to science all the time. And, the same sort of issues have always, whether 100 years ago came up with organ transplants or cardiopulmonary resuscitation technologies and so forth, people were always accused of playing God and so forth. We don't really see it that way. We're trying to help society, help patients and the overall system. And if someone accuses us of helping, if somebody's 4-year-old daughter accidentally falls in the swimming pool and drowns and wants to believe that's God's will, then fine. But at the end of the day, we'll go with the parents and that want us to try to help and heal their daughter.
You call them living cadaver. I mean, has anyone ever kind of accused you of kind of maybe introducing or talking about, I guess, insensitive vernacular?
It actually is a term that should wake a lot of people up, because what most people don't realize, and it's
jarring.
It's a bit jarring, but at the same time, it's amazing what you and I and everyone can do technically when we die. Somebody who has a beating heart and is breathing and is appropriately has nutrition and hormonal support can do many things. They can have a baby. They can fight infection. They can grow. They can mature. They can metabolize, digest. There's a major insult to injury when we lose that tiny connection in our lower brainstem that controls our heartbeat and breathing. It's a major slap in the face. And so, combine that with the fact that when you go into the scientific literature and you realize there's several dozen cases of spontaneous brain death reversal that have been documented since 1968, when we first created the definition of brain death, primarily in very young subjects, you realize that things are not always black and white with regard to sort of the point of death. We've seen a lot of this in the press lately with high-profile cases like that of Whitney Houston's daughter, Jahai McMath from California. And, we think, once again, this isn't our only thing, but we definitely feel it is an area, knowing what we know today, that we did not know in 1968 when we first created the definition of brain death and what it means to be dead and alive nowadays. We have technology, we have knowledge, and cognitive neuroscience we did not have then. So we feel it is an important area for us to work in addition to everything else we do.
It is the 200th anniversary of Mary Shelley's Frankenstein. So on that notion, do you think we'll ever be able to reanimate something from the dead?
I think we will have a very good success in doing it with cases of acute trauma where the body is appropriately supported, a la the cardiopulmonary, nutritional, and so forth, per the model that we're talking about. We are not yet at the point where, for instance, we could deal with things like catastrophic death that you may see, an airplane crash or a war zone. We're not at the point of dealing with time-sensitive death. A murder victim, for example, that is not found for several days. And clearly we're not at a point that's beyond so-called living cadaver realm where, someone is manifesting the overt physical signs of death, putrefaction and all that nasty stuff. But we are definitely, I've said I think we would probably solve the initial steps of death and reanimation of acute trauma before we ever cure cancer. Just because death and brain death, as we know it today, is one thing, right? cancer is 1,000 potential things. Brain death is one. There's one dynamic, one cascade that is the reason 65 million of us will leave this world every year. So yes, I think we'll have a lot of success, but not per Mary Shelley's model as of yet.
Okay, so I should throw out all the body parts I've been saving for my future body.
Yeah.
I
only do that on the weekends. But
it's starting to smell, so it's probably a good idea anyway. Staying with cancer though, Bioquark is doing some work there. Yes. Go into that a little bit more.
Absolutely. So we have known, and this is why I'm a big proponent of the medical past and sort of medical history. We have known since the 1940s that regenerative organisms like salamanders and others can get cancer. They can be given nasty carcinogens in the lab to develop the worst possible tumors, and then the tumors disappear. We have known since the 1970s that you can give an embryo in the lab cancer, reimplant the embryo into its mother, and when the baby is born, and I'm not talking about humans, I'm talking about other mammalian models, but when the baby is born, it is cancer-free. So we have known that for many decades, regenerative microenvironments of tissue organize out what they do not like and organize in the cells that they want to keep. This is a fascinating piece of knowledge that we've never really acted upon. We built an oncology and cancer system based on the kill approach, whether that is chemotherapy, blasting away, and shotgun approach, or the more recent, more sort of sniper rifle type immunotherapies. They've all focused on a kill event, missing the bigger picture, that when you either wipe out the good tissue or when you miss the certain cells, a tumor's going to grow back. And so we want to take clues in our research from nature. We see that all organisms in nature that are resistant and resilient to cancer and death from cancer do not focus on killing it. They focus on changing it. And so the same technologies we are utilizing now in the lab in terms of turning back time to regenerate a body part can also now be applied to normalizing tumor tissues. This is a very exciting area because what we are beginning to realize, not just us, but the whole world of so-called systems biology, is now realizing that what we've been doing and the way we've been looking at cancer for the last 50 years is pretty wrong. These tumors that kill us, they're not these simple mutations that grow clonally. Tumors are much more complex than that. They are heterogenic baskets of cells. And so we need approaches that don't just focus on killing some cells and missing the really nasty ones that then come back and kill us, but focus on change events. And so this has been our focus on how we're going to deal with this, in this era now of sort of war on cancer number 2, how we are going to deal with cancer a little differently, and we think it's going to be much more successful. We've had some very exciting sort of preclinical work in the lab with melanoma, with breast cancer, and with brain cancer glioma models, and this is something else from a company perspective. Oncology is a very important target for us.
And how do you transfer that, applicably, tangibly to the lab? What you're talking about, the actual cancer. Like, what are you guys actually doing physically?
We're developing biologics, so we're basically studying the proteins, the peptides, the microRNAs, the substances that are responsible for this reversion from state B back to state A. And we're isolating those, and we're creating biologics, so biologic drugs, think insulin, think human growth hormone, think vaccines. We're focusing on developing drugs that look like biologics that can basically induce those types of reversions in mammals and humans. So we're not developing synthetic drugs, we're not developing chemical drugs, and we're not doing any gene therapy. We're primarily looking at what happens in nature, what are the specific bioactive molecules responsible for this that we also produce as humans, and then isolating them, purifying them, and creating biologic drugs that can do this as therapeutic.
Okay, yeah, I definitely should not have asked that question. I'm a damn layman. You lost me at Biologics, so, but no, that does sound pretty interesting. You guys are also working in a lot of not just traumatic brain injuries, cancer. I mean, you dabble in a lot of different things. One thing that I didn't notice was anti-aging. What's going on that forefront?
Yeah, so we look at aging as a side effect of what we do, because whether it's regeneration or repair, rejuvenation, everything has this underlying theme, as I mentioned before, of turning back cellular time and going from part B back to point A. So directly or indirectly, we are making a tissue, whether it is your pancreas or your heart or your brain or that limb, we're making it younger in the process of regenerating it. So an anti-aging component comes with everything we do. And at the far end of that spectrum, the only organism that we know of on this planet that is biologically immortal, the Turritopsis nutriculid immortal jellyfish, obtains its immortality through turning back the time in its cells and starting over. It basically lives its life, and then, when it's an adult, it decides it wants to be a child again and reverts the state of all its cells. So there's a similar dynamic that you see in the one immortal species that lives on this planet with us. We're not an anti-aging company per se. We're not going to be developing a drug for aging, but anti-aging is just going to be a trickle down to anything we do. So we regenerate your kidneys in chronic kidney degeneration. Those kidneys will not only be healthier, they will be youthful kidneys. Same with your pancreas, same with your liver, and so forth. So now we are leveraging to some extent with some partners some of the non-RX opportunities in skincare, because clearly skin needs to regenerate, skin needs to repair, and skin aging and beautification and appearance is a big industry. So we have a reason for our investors to be there as well. So that is more of a direct anti-aging target for us. But yeah, hopefully we'll make you younger all around as we develop our therapeutic interventions.
Yeah, I want to die and come back as a jellyfish. That sounds great. Are most of your donors people looking to stave off aging and live forever?
We have some of that, but and while we do run in the circles of a lot of the groups that have a pure sort of life extension, anti-aging focus, most of the people that follow us and most of our investors and people that I have worked with the last 30 years in the industry are more traditional sort of disease-centric folks that have been down X, Y, and Z path and realize that there is a major, what we'll call clinical gap that exists between where we are and where we really need to be. And so much more of a sort of a therapeutic investor as opposed to a longevity investor.
Ira, how old are you, if you don't mind me asking?
I'm 49.
49. You look wonderful. I'm looking at your, pulling back the curtain for a second on the listeners. We're talking through Skype and I see his pictures. Man doesn't look a day over 35. You must have holding back on some breakthrough, aren't you?
No, there's an easy answer for that. I sent you a 15-year-old picture. No. That's me from a couple of years ago. I appreciate that. Thank you.
Oh, that's the secret. Okay, just keep using old pictures. Okay.
I'll send you a picture from the 11th grade. I don't care.
Okay, well, I don't think we need that. But you're talking about that gap. What do you guys expect in the next 5 years? Where do you think your biggest advance will be?
Oh, in 5 years, we will have at least one registered product on the market in the United States, probably our kidney regeneration program in an orphan fast-track disease. And then we're a U.S. company, and we are focused on the U.S., but at the same time, we realize, like most of the smart people, that if you're not active in the rest of the world nowadays, you're missing a big picture of all the countries that are coming online. So we are also partnering up with various healthcare organizations in Southeast Asia, we're in the Middle East, a little bit in Latin America now, because there's other regulatory systems, and if we can get a product to market 4 years faster or 3 years faster, we're going to do that now, because it's a world where you have sort of globalized medical research, and when you see things like Harvard Medical School that is operating in Dubai, or Weill Cornell Medical Operating Qatar, Newcastle University in Malaysia, you begin to realize the permeation of sort of the first world medical system everywhere now. And so if you can no longer ignore, Indonesia or Turkey or Panama or, a handful of other countries that are just, predicted to have major healthcare systems that are coming online rapidly. So we're active there as well. So 5 years, we should have several products on the market from a therapeutic perspective, as well as have our skincare and sort of non-RX business nicely chugging along.
Would you find that the regulatory system in the U.S. Is much more restrictive than globally?
Yeah. I mean, it's a tough system, but to develop anything, you have to go through it, and it's just the nature of the game. Mm-hmm. Yes, clearly, other countries, specifically what we're seeing in Asia right now, are doing things that should cause us to think more. And when you see, for instance, conditional approval processes in Japan, where certain therapies they are going to be allowing on the market after phase 2 for chronic unmet medical needs, that's a major step that we need to think more about here. And then you have even more dramatic stuff happening. I mean, Merck, right, the fifth largest drug company in the world, last year announced a collaboration with the government of China, where basically they set up a tropical island off the coast of China, whereby, if you're dying of cancer, God forbid, you can go take a vacation, sit on the beach and try some of, experimental therapies. So we're seeing some really interesting moves in various regulatory systems around the world that's, may have seemed kind of niche 10 years ago, but hey, you can't ignore the fact that the largest government in the world and the fifth largest pharmaceutical company in the world are trying to do stuff that is just not allowed here in a structured format. So I think times are changing.
Why do you think the regulatory system in the States is so restrictive comparatively?
Obviously, a lot of it has to do with the imbalance that exists between what we learn preclinically and what we ultimately see in the clinic. So, one only has to look at the number, for instance, of rats that we cure of cancer every year. If the rats could pay for cancer drugs, then we'd be trillionaires, right? Nothing translates the way we want it to. The reverse of that is all the drugs that are on the market that ultimately harm us and kill us. So, every year we have 2 million adverse events in this country alone from approved prescription drugs, along with 100,000 fatalities. So there's an odd imbalance between what we see in our preclinical animal work and what we see translated into humans. And this has, this has caused, I guess, the major risk aversion in our system. But there's creative ways of going beyond it. And we see some of that now with sort of adaptive clinical trial design and some of the other techniques that we begin to see in literature, not fully accepted yet, but the fact that, yes, we can study something in 10,000 cats that looks beautiful, but if someone drops dead after the first dose, we haven't done our work right. So a lot of it has to do with the existing models that unfortunately are a bit outdated. We are not rats, we are not cats, we are not rabbits. We are different. And so we need to think a little bit more creatively with how we do these things moving forward.
Anyone ever run up to you and try to donate themselves to your science to be reanimated?
Yeah, we actually had that. We don't, we don't have a sort of a cryonics type model whereby somebody will donate ahead of time. We discussed it a bit, but it's, we just have a lot on our plates right now, but I think there is something there. Unlike cryonics as an example, where, they basically want somebody really smart 500 years from now to solve your problem. in our case, we prefer to solve the problem today. And if the model exists, let's do it, because the sooner we can solve death, or sort of the short-term bridge between life and death, then we can begin to say, wow, okay, now the cancer that killed you, we can spend a lot more time on, and know that a reanimation event in 5 or 10 years, or whatever it is, somebody will be coming back that no longer has cancer as well. So, I think there is potentially a model there. We just have to hash it out a little further.
And I've been holding back this question because it's the most important, obviously. Do I get a discount for interviewing you, or what? No discount?
Absolutely. Absolutely.
What a guy.
This is why I love talking to folks like you, and I love the fact that you read ahead of time and ask good questions. So absolutely.
Oh, yeah. I mean, the discount was the first question that I thought of in my mind. There wasn't much research going on for that one. But yeah, for any listener who's obviously, I mean, intriguing stuff that you guys are really doing, really some controversial but really cutting-edge stuff, and I'm fascinated to see what's going to be going on. I'll be following your company. Give some people some social media information about Bioquark if they want to follow up.
Yeah, just bioquark.com, BIOQARK. We list everything that we do and everything we're about on the website. We are very transparent. We don't shy away from talking about any of these topics. So reach out to us. Contact us through the website. Contact me directly through the website. Once again, we're passionate about what we do. We think the time is right for all of these things, whether it's aging or death, to be addressed in a more structured, disciplined fashion, and we think it's a very positive future as far as the biomedical sciences are concerned.
Don't let me hold you any longer. You got some people to bring back from the dead. Mr. Ira Pastor, CEO of Biocourt, thank you so much.
Thank you so much for having me.
Thank you for joining us on our bow wrapping part of the show. Mary Shelley once wrote in Frankenstein that nothing is so painful to the human mind as a great and sudden change. I imagine that there were probably a few jarring moments in tonight's double dose for the 200th anniversary of Frankenstein. We could also use that same quote and apply it to our next few shows. We're going to talk about the 50th anniversary on the assassinations of Martin Luther King Jr. and Robert F. Kennedy. If you've been following the show, you know we have a blog on that as well right now. We're also going to be talking about some historical secrets and hoaxes. Get the information now on these upcoming shows and the blog on our website, themindseyemedia.com. Again, themindseyemedia.com. I wonder, therefore I podcast. I think, therefore I blog. I'm your humble host, DJ BJ Turnoff, signing off for The Mind's Eye on Z Talk Radio.